Many of our clients who
Yeah.
lately we come to know that they have got very classic conditions of ADHD, they are many times misdiagnosed by psychiatrists.
After 40s, most of the time when women go in a perimenopause, of course your hormone imbalance started, and then I think your symptoms of ADHD get more worse. If your hormone imbalance, if your life stresses, there's no life stresses, all of the cycles are balanced, your ADHD is going to be balanced. And I said, that's not going to be possible. He said, but that's the reality.
Assalamu alaikum, Gul-e-Rana, how are you?
I'm fine, alhamdulillah.
So good to see you here at House of Wellness.
And thanks for having me.
It's a delight, it's a pleasure. So many nostalgic memories and so much to cherish about, right?
Yeah.
और बहुत सी commonalities, Gul. We are class fellows.
Exactly.
And we are lately diagnosed ADHDers. So, welcome to Pakistan and welcome to House of Wellness. How is it to be here in Pakistan after so long?
I always feel good coming back to Pakistan because it's just like a home for me. Especially all of the memories come back growing up, like especially in Kashmir, and half of the time I've spent life in Islamabad, you know, and just to meet old friends and family, because I think wherever you go in the world, your roots always connected with the Pakistan.
Indeed.
So
indeed.
I'm so happy, you know. It's a short trip, but I just try to, you know.
No, we are happy
most
to
of the
have
time.
you here, to see you here as well.
Yeah.
थोड़ा सा गुल अपने मुतालिक बताए, अपना background as a therapist. How did you make so many headways in your life? So what's the trajectory you followed?
It's a very long story. Of course, half of the time I think you know about it. Of course, we are class fellows, so of course I grew up in Kashmir, and then I completed my schools over there, and then I just moved to Islamabad and for my higher studies, and did my masters and MPhil in psychology, and then I practiced I think almost 2 years as a psychologist here, and then I think few years back I moved to UK. And so I think I would say start from scratch over there because of the qualification. It's a bit kind of difference, you know, with accreditation process. So did my further training in cognitive behavior therapy, and at the moment I'm based in London and practicing in NHS under the government as a CBT therapist, and also I'm trained in EMDR. And last year I started my private practice. So alhamdulillah, I mean, clinically I'm doing quite well. And so I think it's just like a big milestone, I can say, because of we are talking about especially about the ADHD. So I'm not saying that it's a smooth process.
I know.
It's a very, very long process, and I think I would say I work harder than a normal person. And now I can see that hardness.
Where did it come from?
Where this come from, yeah.
Yeah, I understand. I
Yeah.
understand. We'll talk more about
Yeah.
it. When did you first start to suspect that you might have ADHD? You need to know about this disposition.
To be honest, it's kind of, I always wonder where, because I can't give you a timeline. Because, you know, when I was growing up, I was thinking there's something, it's not right with me, you know, but I can't put the name. What is it? Like in Pakistan, we don't have as such about kind of awareness about like ADHD and autism, because when you go about ADHD, it's more about like, you know, jumping in the class, moving here and there. There is some element, of course, I always consider as a naughty child. Especially when I was in a class, and
I
naughty
can vouch
kid,
for that.
exactly, you know, naughty kid, you know, all of the kids gang, you know, in the street and climbing on the trees, you know, and jumping in here and there, you know, and to be honest, in university, like I can't, like, it's really difficult. I think when I moved to UK, and I think it's just the awareness from my surrounding, you know, when you hear about what actually is ADHD, you know, and then you try to sense some of the things you can read. Actually, this is me or not, you know? and then you wonder, but you still can't pinpoint the answer for it. Yeah. Thanks to my husband, recently when we got married, and he said, I think you might be have ADHD. Even I'm a practitioner, but sometimes you just don't want to say it because I think it's because there's a lot of stigma attached, and then you're too scared that what's going to happen to you. If you say, oh, maybe I have it, or maybe I don't have it. So I can say, like, for the last 10 years, I suspect there's something wrong with me, but I think my husband, probably pushed me. You need to check it out, because I just drift away in the communication, I might be while I'm talking to you, but at the same time I'm thinking something else probably.
Yes. So
if I drift away, just stop me as well. Yeah.
So we should be welcoming towards our spousal criticism and should not take it as a criticism, rather a prelude to an exact diagnosis.
Exactly, Yeah.
So interesting. Looking back, what signs, what symptoms, patterns do you recall which now you think correspond to being an ADHD?
With symptoms wise, it's quite difficult because I think when I was young, I was more hyperactive. Yeah, because I do things quite impulsive without thinking about the consequences. Yeah, like doing pranks and just like winding up other kids, picking fights, and I think it's just kind of really difficult. I think the one thing which I say is inattentiveness is quite. I would say it's like a very bigger thing, especially in the classroom, one teacher is dictating something and you can't follow. Like, you think that why are you so slow, Like, it's just like you can't follow the instructions they keep telling you. And I know we're talking about the ADHD, but I have dyscalculus because I'm so bad in maths. Because numbers, when they show me, it just freak me out, with percentage and fraction, and it's kind of really difficult. But I think inattentive, hyper focus, sometimes impulsive, pick the fights, and I think I struggle. I think in relationships all of my life because I say things without thinking. In that moment, I just have a pressure cooker, and then when that dopamine go down, then you realize, hold on a minute, you just regret, and then people consider you rude, So sometimes it's really difficult. So it's more, I would say, about symptom-wise. There's a lot of variation, and especially with the girls, it's really difficult to pinpoint because your symptoms is very different as compared to the boys.
How did this diagnosis change the way you look at yourself personally and professionally and relationally?
Well, it's a very difficult and very complex question because of course I'm not diagnosed, I'm saying 10 years back. So I was diagnosed last year, November. So you can say it's a couple of months. I'm still in the process of absorbing what is it and what's my life is going to look like. It's kind of really difficult. I don't know. I'm just trying to accept the way I am now. And before I think a lot, but I'm not saying I'm not thinking a lot, but I can't fix some of the things when my brain is like that. So I try my best to just do what I can do in my capacity. Before I might say so many things and yes to other people, but I just step back that I just need to put myself first at what I can do, what I can't do. I think the first thing which I did at my work, I spoke with my manager. And we have an occupation therapy meeting where they discuss with me what are the reasonable adjustment I want, especially with the meetings, patient spaces and all of these things. What are the things I can do in my capacity, where are the things when I can't do, and when there's longer meetings I might need some break in between. So there's a lot of things with the time management and sort of things. I'm quite open about it, but I'm not saying that I'm just crying out, oh, I have ADHD, but it's just I'm trying my best to just accepting myself and be open about it, that if something is going wrong, this is not it's my fault, it's me.
I got it. Just a little touchy and sensitive question here. Gul-e-Rana meets a 23, 25, 27 years old Gul-e-Rana. now, and knowing that what was going on at that time, how would you like to meet and greet her, and what would you like to say to her?
It's a very emotional question,
I understand.
I know before we coming up, I was saying I'm about to cry, but I'm not gonna cry. I will try my best. If I cry, it's okay as well. If I cry as well. I think it's really difficult when I look back. I think at that time, I just remember now because I think I was got married at that time as well, and of course all of the responsibility just come, and I don't know what to do with it. And I think I just need a hug at that time, just to slow down. Yeah, and just show that compassion to that little girl that what you're going through is okay, because you try to fix everything because you want to do well as a wife, as a sister, as a daughter. It's really difficult, and because as in one role you have so many roles, and then and on top of your brain is so different, and sometimes it's quite overwhelming to fit everything in one place. And I just feel like sometimes I just have a kind of grief reaction for myself that that girl just suffer a lot at that time. And I'm not saying that I need that kind of sympathy for that girl, but I just want to show that it's okay. That we got you. The only thing is that I just feel like that the support I might need at that time, I don't have it. I wish I would have at that time.
I understand that. How did it change the way you look at your patients, the look at your therapeutic interventions, your professional outlook towards your profession after being diagnosed?
Well, I think it's because when I just have my reasonable adjustment work as well, I think I try to pace my sessions, Because sometimes when we see patient one by one and no have space, then I just feel like my brain is draining literally. So I need time to breathe. And of course, record keeping sometimes is difficult, So I try to make sure that everything, either sometimes I use dictator to record, because sometimes of course when you are with the session you need to be with them wholeheartedly, and sometimes
certain logistics get missed.
Yeah, exactly. You can say certain logistic wise I need to be very careful because I need to be organized, for every session. And sometimes I think it's kind of, and I'm not saying this 100% it's not affecting my practice. Of course, it still affects my practice, but I'm just trying my best to just do what I can do, to see my patients. And I think some of the patients, because they come with the due diagnosis a lot, so I can relate with them as well. And I try to comfort them when they come in a session in 100 miles speed, and then I say, it's okay, I got you, because I know what it feels like. And I think it's about yourself that you can, I don't know, you can relate so much with them, that what are their struggles, and even when you just say to this patient, I can get you, and it's okay to feel like this. There's nothing wrong with it. It's about it's all about the stigma attached. Because sometimes I was worried about, is it my people gonna see me differently now because I'm ADHD combined type? Are they gonna see me differently because my work might be affecting? So all of these things, I think sometimes it was quite scary as well, but I'm just taking I can say one step at a time and try my best.
Well, what are the cultural and gender specific correlates of having ADHD, being diagnosed with ADHD, especially when we talk about cultural specifics? I'm talking about UK and Pakistan. If you get diagnosed with ADHD, what kind of support you can seek, you can expect respectively from your personal and professional stakeholders. And when it comes to gender, especially for women, and especially their life cycles like perimenopausal phase and again going through ADHD, What are your thoughts about it?
I think it's quite difficult as well. I think the cultural element is quite important. Because I think growing in Pakistan, I think it's kind of really difficult because first, either it's a boy or girl, awareness is always a problem because people don't have awareness. Then there's a lot of stigma attached. Like, of course, we notice a lot the boys being diagnosed quite early because of their hyperactive symptoms is quite common. With women, because they are quite inattentive, or maybe if they find something or there's something not right with the girl as well. And I think the stigma attached that, the girls needs to be diagnosed. What's going to happen later on in life? Because she has to get married. She has to.
The biggest.
Exactly, she's not going to get rishtas, and everything, because they consider, she has some kind of disorder, And I think it's a kind of, it's a very shameful thing, I would say. It's like, I'm lucky, to be honest, because I'm in UK at the moment, so I got the right support. Because I sense there's something wrong, then I need to go and check it out. And of course, it's a very long waiting list, but at least I got diagnosed and I know about it, what it feels like. But I think it's in Pakistan, when you're a girl, so there's a lot of difference between how you treat girl and boy differently. If boy has a problem, there's no problem, they can take it to the doctor. With women, it's quite a really different, especially with a girl child. And I think you have lots of expectations as a girl to do well. If you are not doing well in the studies, so it means you're not gonna give lot of opportunities to grow well or will get the right support from very early age. With a boy, maybe it's different. I think I'm a bit lost now as well.
It's okay. That's part of the.
That's what I'm saying because it's a very difficult thing to pinpoint where you have to start.
Just to prompt it.
Yeah.
Okay, that is the difference. Cultural gender difference, right?
Yeah.
But now let's talk about typical gender-specific challenges. For instance, the changes a women experience during their perimenopausal phase and menopausal phase.
Yeah, exactly.
And then again having some symptoms of ADHD, ADHD as a condition. So their cross section and what kind of challenges they bring up.
Because what happened when you are after 40s, most of the time when women go in a perimenopause, of course your hormone imbalance started, and then I think your symptoms of ADHD get more worse. First, I thought that I might just going mad because the brain fog, forgetfulness, which I had before as well. But I think with the perimenopausal symptoms, your symptoms of ADHD get worse. So I went to the doctor. I said, I don't know what's going on. I'm just going mad. Like, I can't remember anything. I'm just missing more appointments and deadlines, and there's something going on. And then at the same time, of course, my mood fluctuate really bad. So first they say, it's hormonal because maybe this reason. But then, of course, then I went to the doctor. They say, okay, maybe it's ADHD as well. And then they explained to me about because your estrogen level gonna go down, so it means your dopamine activity in the brain is gonna go down. So your symptoms of ADHD in the women get more worse when you age. And sometimes, because if you don't have awareness, it means you might think, you are going through menopause now. So I think it's just because I read a lot about just to try to differentiate between what is perimenopause symptoms with ADHD, and sometimes it's really complex because they are overlap. And when you age, the symptoms get more worse. And of course, I remember my doctor say that if your hormone in balance, if your life stresses, there's no life stresses, all of the cycles are balanced, your ADHD is going to be balanced. And I said, that's not going to be possible. He said, but that's the reality.
All of utopia.
Exactly. And of course, at the moment, I'm waiting for the medication because we have difficulty all around the world now with ADHD, shortage of medication. And of course, because I'm just like a guinea pig at the moment, to be honest, just to figure out that what works, doesn't work. I don't know about.
And it brings me to the same question. You are coming from the developed world. Here we are talking about even Pakistan,
Exactly.
where retinol,
Yeah.
any med, which is with its due shortage, still is prescribable med.
Yeah.
Over here, it's not available at all.
Yeah.
Right? But what kind of ideal treatment plan a person with ADHD should expect and should work around?
So I think there's a lot of charities which are working with the people with the ADHD. ADHD coaching is quite common, where normally they, I think, help you to support you in your life, like how if someone is difficulty having time management, organizing some of the day-to-day stuff. And one of the option is medication as well, because I think it's just help with some of the, I would say, I'm not going to use very complicated language with the neurotransmitters. It's just calm you down, just remain more focused. And then, of course, you have, like when I say about the coaching, there's a therapy option available as well. And of course, the other thing, the main important part is your family. How they can understand you.
So their psychoeducation.
Awareness is quite common, you know. If your family is not understanding you, there are certain things you do in a certain way, and some of the things is not difficult. Like, for example, if I have to do 10 tasks, then I know that's gonna be a very bad day. Now my husband knows about it, that okay, I can do 1 or 2 things in a day because I have to plan for it. Yeah. And especially if I have to go somewhere and that plan is a bit changing, then I'm just all over the place. Then my husband, no, I think he knows about it. I need to know about it, what's going on. I need to know about it. And I know sometimes it's quite difficult. Life is quite unpredictable. We can't control everything. But that control bit in my mind might be difficult to some other ADHD person. So every person is different. So every person plan of intervention might be different. But the standard one is ADHD coaching, therapy and medication. That's the standard.
That work. And it brings me to another question for our audience, viewers. Would you like to share some insights about ADHD as a disorder, the correlates like time blindness, rejection sensitivity, hyperfocus, so that people can not making them hypochondriac, everybody starts feeling like ADHD. But what merits to be a clinically diagnosable condition of ADHD? So would you like to share some insights?
I think there's something because ADHD is a very kind of very complex disorder as well. And there's a very main symptoms about, like I would say, inattentive, hyperfocus, poor time management, and all of these things. And especially like emotion dysregulation, impulsiveness. These are very common symptoms. But again, I'm saying sometimes there's an overlap with other disorders. Like if we say when a person with the ADHD, when they are in hyperfocus mode, people might think they are manic. And when their dopamine level is down, they might think they're depressed. So it's kind of difficult to clinically put down, these are your tick boxes, yeah. And sometimes the main thing I would say that if you feel like that, like if you have, or if you think you're struggling with this condition, I think it's worth having a psychiatric assessment.
That's fine. But Gul, let me tell you something very undesirable here.
Yeah.
Many of our clients who lately we come to know that they have got very classic conditions of ADHD, they are many times misdiagnosed by psychiatrists, like as you said, some maniac disorder or condition or depression. Most common, the diagnosis of pure ADHD is because of low dopamine. It's depression. And they come to us after having medications for years. And then we are aware that it is primarily ADHD. So do you think that this misdiagnosis of ADHD is there in the developed part of the world as well?
Yeah, I mean, of course, it's kind of really embarrassing to say sometimes people like to be labeled as ADHD. They are neurodivergent because there's a certain population, I think, in the developed countries where they think it's like a trend. But of course, like I'm saying, because some of the disorders are quite overlapped, so sometimes people are misdiagnosed as well. Because again, we are talking about ADHD, we're talking about autism, we're talking about depressive disorder, we're talking about bipolar, we're talking about EUPD, like personality disorders. If you say that in ADHD, sometimes you have all of the traits in one person as well, or some of it. So there would be error, I can say, will come that you may be misdiagnosed. But sometimes you know yourself very well. Then the doctor as well, I would say.
Let's talk about another aspect. Let's bring some brighter side of the story.
So depressing now. Let's come to something.
Yeah, let's come to it. Can ADHD be good as well? Can it help us sail through certain high tides of life? Being an lately ADHD diagnosed person myself, if I look in retrospect, few of my decisions, few of my choices, which turned out to be very blissful ones, were primarily driven by my ADHD brain. And I don't have an iota of regret that I made those choices. Rather, they added to the collective profile on my part, be it my personal or professional pursuit. So do you think at times ADHD is helpful as well to stay, to keep pace with the hyper active surroundings? Our hyper focusing helping us getting some task done which actually requires hyper focus.
I think, of course, like that's what I'm saying, every person in the world, they come with some traits. Just forget about ADHD for the timing. Just forget about it, like, because everyone has some skills and they're good into it. It's the same when we go back to ADHD. So my part of hyperfocus, I have said, is a positive quality. Because if I have to do something, I just go straight and I can do it. Maybe the neurotypical brain might not be able to do it, but I just focus on it. But the downside, sometimes people around us, they find it hard that you need to slow down. But no, you are going with that task and then you have to do it because you're not going to do it. Your brain is just like go back and forth. So for me, it's a positive thing because I think it helps me in my career. Because when I choose something, I have to do this thing in a certain way, then it means my brain go in a plan mode. Then I have to do it. But of course, like I'm saying, there are the scene I take on in my life, which I think you say that might be a regret because that's part of my ADHD impulsive part. Then I didn't make choices, and I hurt lots of people as well, But of course, this is also part of the ADHD. But of course, now I look back and then I say about what the hell I did, And people might be watching me today, then might be they can relate, actually, this is me,
That's important. Okay, Gul, as you said, at times it becomes a sort of fashion statement and in vogue to be diagnosed as neurodivergent, neurospicy, and
there's a lot of names of it.
A lot of names. That is one side. The other side is people are being either underdiagnosed, undiagnosed, or misdiagnosed here in Pakistan. One thing remains common. Okay, if it is a fashion statement, it means that you have overcome the stigma attached to it. But in here, Pakistan, we do have stigma attached to any minor, moderate or severe disorder.
Exactly.
What should we do to destigmatize need to seek help?
I think it starts from the schools.
Okay.
Because education is quite important. Because people don't have insight about that this problem exists. And I think they just brush under the carpet. When I say about the schools, it's not that, we have to develop some kind of curriculum, but I think there would be some kind of sessions should be arranged in the schools where they normalize that it's okay if someone has mental health problem, or they're struggling with ADHD, or they have autism, or any other mental health problem. Because I think, and Like, let's imagine if we are talking about the schools as well, but who's gonna go to the parents and the other public as well? So there's a lot of, I think I would say awareness required on the media level as well, just to normalize people. Because of course I know it's a very long journey, but I'm hopeful maybe one day Pakistan will be there, where they can accept this is not kind of some kind of abnormal thing,
And it brings me to my last question.
Yeah.
You've got few minutes, and you've got an opportunity to talk to those people from every age group, that is school-going children, their parents, from them to young adults, adolescents, young adults, and people like us in their midlives being now diagnosed with this condition. What would you like to say to them?
Just ask for the help. That's what they want.
And how would they come to know that they need help? What do they need to read more within themselves? What do they need to be vigilant and cognizant about?
Yeah, I mean, because sometimes, like I'm saying, most of the times the awareness comes from yourself, that there's something when you can see the difference, that certain things you do in a certain way might be you're unable to do, like when the neurotypical brain might do. So of course sometimes you have to read about yourself, that what are your difficulties which might stand you out differently from other people. And like I'm saying, it's okay to ask for help and maybe check with your family members that how you see me differently, or if the family have awareness, then you can check with your doctor as well. But of course, someone has to start somewhere, isn't it?
That's true. Thank you very much, Gul, for being here and having such a candid and interesting discussion with us.
Thank you.